Black History Month is celebrated every year, and it provides an opportunity to celebrate and honour the contributions of BME individuals within society, particularly the work that has been done and that is being done to further advance diversity and inclusion within the workplace. My name is Leah Asante, and I'm one of the senior lecturers within the podiatry department at Huddersfield University. I'm also a PhD candidate, and I'm just going to use this opportunity to talk about the research that I am undertaking. So my investigation is looking into whether morphological differences exist between the feet of those of African and European descent, with a greater emphasis on those of African descent who present with the pes planus foot type. And that's to ascertain whether this foot type is an abnormality, as literature describes, or a norm. To do this, I'm using the foot posture index and footprint measurements. So this came about after working within the NHS and the private practice for over 15 years, seeing a diverse range of patients within that time. Now, within that time, especially seeing those of African heritage who presented with the pes planus foot, I did notice differences, and a lot of questions were raised within that time. Those who did presented without any pain or discomfort or anything that, the vast majority of them, anything that caused any problems within their day-to-day living. So it led me to question where this presentation fits within the biomechanical theory, and also where it fits within my undergrad learning and my postgrad learning, because there just did not seem to be a place within literature or within my teaching. So the question that primarily was raised was, is this a norm or is this an abnormality? What are these differences, and or what may these differences be, and how would this affect my clinical treatment or clinical treatment as a whole? Now, within literature, the pes planus foot is synonymous with the abnormally pronated foot or the pronated foot. It is also described as an abnormality, and obviously also within that is associated with posture abnormalities, which lead to lower limb injuries and problems, impair sports and performance, pain, etc., etc. And that's just to name a few. Now, my reality within practice, what I was seeing, did not marry with what it was not reflective of literature. So, as I said, questions were raised, and it opened the door for me to carry out this research. So what I did was I got two different groups, the African descendant cohort and the European descendants. I went out into the field and I carried out measurements in a standardized manner, using the Clark's angle, Chipo-Smerick index, the Healy-Arch index, affinity, and the foot posture index. And that was to taking those footprints, taking those measurements to compare and contrast both groups in, as I said, a standardized manner. Now, what I'm going to show you next are a few of the results that I have collected throughout this period. So using the Clark's angle, as you can see, the blue cohort represent the blue columns represent the black cohort, the orange amber columns represent the white cohort. So you can see that under the severe flat foot classification, the vast majority of, or over half of, the black cohort are classified as having severe flat foot, and when you compare that with the white cohort, they are veering towards the normal, most of them under the mild flat foot, but they're in the opposite direction. And this is showing that there are morphological differences using this measurement tool. When you consider affinity, now affinity measures, well, I measured the foot surface area using affinity. and that is the area of the foot, so the plantar aspect of the foot, which is in ground contact during weight bearing. As you can see, the black cohort have a far greater surface area measurement than the white cohort, and it's actually significant, having ran the tests already. So that's two of the tools showing that there are morphological differences within the black cohort compared to the white cohort. When we consider the foot posture index, which is the clinically based tool, we can see that most of the cohort, both black and white, fall under the normal category. That obviously raises questions. Why are certain tools demonstrating morphological differences while the foot posture index is not? That's where I am. That's where I'm at just now. I'm obviously analysing the results, trying to understand what they are showing. Now, it's not just the two tools that I've shown you. All four of the footprint analysis tools are showing that there are morphological differences. The foot posture index is the only tool that isn't. Now, the question that's arising is this important? If so, why is it important? If it's not important, why is it not important? So these are the questions that I'm considering at this moment, looking at the results, analysing the results and the data, not just the classifications, to come to the conclusion that this thesis will conclude with. Just to show you some of these footprints, so on the left you have a footprint of one of the black cohorts, and on the right you have a footprint from one of the white participants. You can see that there are morphological differences just looking at the footprint on its own. And as you can see from the classifications above, the participant within the white cohort is pretty much demonstrating what would be classed as the normal foot within literature, other than the Clark's angle. However, one thing I will say about the Clark's angle is the results have shown that it overestimates the categories. So essentially, the foot on the right, which is the white participant, is demonstrating the normal foot, whereas the foot on the left, other than the foot posture index, is showing that that participant is presenting with a flat foot. So if we consider what literature says about that, then make your own conclusions. Now, when we look at this picture, my question is it a difference or is it an abnormality? Simply because when you look at the arch, yes, it's lowered, but is it majorly abnormal? Is it abnormal? No, I think it would score 1 on the foot using the foot posture index. When you look at the posterior aspect, you're not seeing a talonavicular bulging, you're not seeing the abduction of the forefoot, which you would expect when you consider what literature says regarding the pes planus foot and its acquaintance with the pronated foot. So obviously, questions are raised. You have to consider what you're looking at. You can't just almost do some sort of algorithm. If a patient presents with a pes planus foot, that means they have everything that falls under the pronated foot type. Because this picture here, my results are showing that that's not always the case. Now, I'm not saying that all black people have flat feet or the pes planus type foot, because we don't. But there are differences, just as there are differences within the white cohort, the white participants. They all don't present with a high arch. Some present with a pes planus type foot, a lower arch. So it's just looking at those differences to ascertain whether it falls under the abnormal type foot or it's a difference that we have to break down and see how we're now going to treat this foot presentation, if it needs treating at all. So as I said, that's where I'm at with my research. I've collected all my results. As I said, I'm now analysing them to come to my final conclusion. So I have a little bit to go, and I will keep you updated. So thanks for watching, thanks for listening, and hopefully in your practice you will be looking out for what constitutes the pronated foot and what is just the difference in terms of the pes planus foot and its difference collectively. So thank you. References, and the journey continues.